Well, hey, everybody, this is Robert, and welcome to today's show. Now, last fall, a 44-year-old man from Italy was bitten by a dog in Zanzibar, Tanzania. He did not receive any pre-exposure travel rabies vaccinations. However, after he was exposed, he did get post-exposure vaccines, but no immunoglobulin, as that was not available. He spent 42 days in the hospital and eventually did die from rabies. Joining me today to talk about rabies and advice for travelers to high-risk countries is Jonas Nilsen, MD. Dr. Nilsen is a physician, he's a travel vaccination specialist, and the co-founder of Practio, a startup making high-quality healthcare accessible for everyone. They do this by providing a technology platform that enables pharmacies to work as local healthcare hubs. And he is speaking to me today from Denmark. Dr. Nilsen, welcome to the show, sir.
Thank you.
Can we go ahead and start out talking about the Italy case? He went to a country that's, I guess, high risk for rabies. He did receive post-exposure prophylaxis, at least at the vaccine level, and he still died from rabies. Can you talk a little bit about the details of this case?
Yeah, sure can. So Tanzania has actually tried to eradicate rabies by vaccinating dogs in the country, but haven't been quite successful with that. I think they've managed to vaccinate about half of all dogs in Tanzania. But what happened with this 44-year-old gentleman was that he's from Italy, and he went with his family to Tanzania, where I think it was on the first day actually, he was bitten in his right hand by an aggressive dog on the island of Zanzibar. So immediately afterward, he went to the doctor and he received the post-prophylactic vaccines, but he didn't receive the immunoglobulins as is recommended by the WHO. He did wash his wound immediately with antiseptic solution, and then afterwards seemed fine. So he went home to Italy, and after some time he felt bad, and so he went to the hospital, where he actually presented with difficulty breathing. So his clinical condition was really deteriorating, and it was in his anamnesis, his story, it was unveiled that he didn't receive the post-prophylactic treatment, and that he also was immunosuppressed. So that was actually so he was then transferred to a specialized hospital to receive some further treatment, where he died after 42 days of stay, unfortunately.
For the travelers listening or watching on this program, Dr. Nilsen, what is rabies and where is it found?
Well, so rabies is a viral disease that is transmitted to humans, usually through the bite of or scratch from an infected animal, usually a dog. But it could also be, it could be bats, it could be monkeys, it could even be a pig. So the virus is present in the salvia of the animal, and when the virus gets into the nervous system, it attacks the central nervous system, causing a progressive damage to the brain and the spinal cord. So the symptoms of rabies is there could be some symptoms to begin with, which could be some feeling disturbances in your hands or in the place where you received the wound, and it could be more sort of asymptomatic symptoms as well.
Now, for travelers, not every country is at the same level of risk. If you come to the United States or if you go to the UK, you don't have the same risk as other countries. What countries are at the highest risk for travelers?
Yeah, so across the globe, really, there is rabies. It's in more than 150 countries in all continents except Antarctica. And as you said, it is present in the United States, for instance, and in the UK and throughout Europe. But there are countries that are at more have a higher risk of rabies. Southeast Asia and Africa are probably the continents where there is the highest risk. So Africa is indeed a place where you have a high risk, but also places like India. India has about, I think it's about 50,000 deaths annually to rabies. And about, say, in Thailand, which is a very popular destination for a lot of tourists, both from the US and Europe, about 5% of all street dogs or stray dogs has rabies.
Wow. Now, you're a travel vaccination specialist. What recommendations concerning rabies vaccine do you have for travelers?
Yeah, well, so according to the UK guidelines, and this mirrors the CDC guidelines as well, is a pre-exposure immunization is what is really recommended if you go to a country where there's a high risk of rabies. If you travel for an extended period of time, which usually is about 28 days or more. So that's one parameter that you would look at as a doctor. The other one would be what kind of what is the tourist going to do? Are they going to go for hikes? Are they going to spend time close to animals? Things like running or cycling are high-risk activities, really. And also, if you have a prolonged, if you have a long distance to quality healthcare, because as you saw with this Italian gentleman, you need prompt treatment if exposed, and if you have more than 24 hours to high-quality healthcare, that is definitely something that you would look at as well.
Now, post-exposure prophylaxis includes rabies, immunoglobulin, and the vaccine series. This gentleman did not receive immunoglobulin, so I'm asking you, what is the importance of the immunoglobulin portion of PEP?
Well, there haven't been done any controlled studies on this for ethical reasons, but the case reports that shows that if indeed a person have been exposed to rabies, then if only the vaccines are given, about half of the patients will die. And if the patients receive immunoglobulins, they basically all of them survive. So it's a very high importance. And the thing is that when abroad, many destinations don't offer this service, offer this immunoglobulins. Many places because it's not available, but also because of lack of knowledge, really. Mm-hmm. And I can give an example, really, because I had a patient who was in Mexico, which is not a high-risk country, but it's not a low-risk country as the United States either. But he was out running at the beach, where suddenly two dogs attacked him. He had like 1 second before he saw the dog until it bit him. And afterwards, he called his travel insurance, who sent him to a hospital where they weren't aware that you were supposed to give immunoglobulins. So what they had to do is to transfer him to another hospital, which was in Mexico City, which was quite a travel. And even there, they had trouble finding out where you can actually find immunoglobulins. There's only 7 places in Mexico where you could actually receive this treatment. So that is really one of the problems when abroad, that, I mean, even if you know that you need immunoglobulins, it's really hard to come by. So oftentimes what travelers need to do is basically to go home, to travel home promptly within 24 hours to receive the correct treatment.
Right. And just for the listeners or viewers out there watching that aren't familiar with immunoglobulin, can you explain what the purpose of it is?
Yeah, really. So when you provide these vaccines, there are 2 parts, as you said, of the post-exposure prophylaxis. One is the vaccine series, and you give that on day 0, 3, 7, and 14. And if you're immunosuppressed, you also give a 5th dose a little later. And that gives you, that enables the body to produce antibodies. But it takes a little bit of time, really, for those antibodies to be created. So what the immunoglobulins is, it's obtained from the plasma of immunized and screened human human donors, and it provides the patient with a passive immunization. So it really protects the patient for that 2 to 4 weeks it takes for the vaccines to really kick in.
Right. What should travelers do while they're in another country, a high-risk country, or even not a high-risk country, to avoid rabies exposure?
Well, they should first and foremost not approach animals. And I mean, even dogs, they look really cute and they can seem very unharmful, but you never know. So don't approach any of the animals. It also includes monkeys if you're in a monkey farm or other animals. So don't pick up ill or unusually tame animals either. Do not try to attract stray animals by, offering food or something like that. And then cycling and running are really activities that can trigger dogs to run at you and attack. So that should be avoided as well. And then one thing to keep in mind is that children are at particular risk as they are more likely to touch animals. They may not understand quite the risk of doing that, especially if they're below 6 years old. So, and they may not even report if they've been bitten or scratched or licked on an open wound. So actually about 40% of all infected people are children, unfortunately.
Yeah. Last question. If you are bitten by an animal while you're out of country, what steps should that individual take while they're in that country and also when they get back home?
Yeah, well, so if you are bitten or scratched, because the dogs can lick on their on the paws and scratch, or licked on a wound, you should wash that with soap and water immediately or as soon as possible, and then apply alcohol gel or some alcohol to try to eradicate the virus. And then contact a local doctor and your travel insurance to ensure that you are transferred to the best place possible when abroad to receive the correct advice. And then when you get back home, then you should contact your doctor and ensure that you are followed up with a good quality healthcare institution. Because as we saw with the Italian gentleman, unfortunately, he hadn't received the correct advice when abroad. And as I said, that's a very common thing. So make sure to contact a proper institution when you get home.
Great advice. I want to thank you, Dr. Jonas Nilsen, for your time and your expertise today. I appreciate it, sir.
Thank you. Thanks for having me.